My name is Rob Winslow. I'm the Director of Electrophysiology here at Danbury Hospital. I think in Danbury, one of the ways that really stands out is the care you get. And here it's really one-on-one physician care from the outpatient setting through the procedure and into the follow-up. Hi, good afternoon. How are you?
Very good.
And get the families through the procedure as well, because that's almost equally as important. Okay. And actually I was very happy with how it went. I'd want to see you back in 2 weeks, okay? By birth I was a Midwesterner. I did my high school, college, and medical school in Chicago. When it came time to look for a job, I knew that there were physicians in this area looking to expand the heart rhythm specialty. And for me, with a wife and a young daughter, we were really looking for an area that we could settle down and have a great work-life balance in doing so. I really enjoy being a heart rhythm specialist because oftentimes we can take problems and fix them and have them never be an issue again. You know, from the young college student who gets these racing heart episodes that prevents them from playing their college sports, and you know, you do a procedure and then you get a card from them 6 months later saying they've never felt so good or been able to perform so well. It's really heartwarming because we really can fix these conditions and really improve patients' quality of life going forward. Our field is so dependent on technology. We've tried to really get cutting-edge care that patients don't have to travel for. That historically, when I came to this area, patients who needed electrophysiology procedures, the closest place they were going was an hour and a half away in New Haven or an hour and a half to 2 hours in New York City. And what we found is that we could provide this sort of care in a safe, highly effective environment and make it convenient for patients and their families where they don't have to go hours and hours away to get world-class care. So this is the system that allows us to make these three-dimensional maps of the heart. These different colors relate to different areas of electrical activity. Where the colors start getting very dense and changing quite a bit is oftentimes where the critical areas of the abnormal rhythm are. This is a very exciting time to be dealing with heart rhythms. Over the last number of years, there have been huge technological advances. There's been technology developed where we can take electrical recordings from many different sites in the heart at the same time, down to a few millimeter precision. And we actually, within the last 4 weeks, have gotten upgraded to the most recent iteration of this that is called the confidence module. And we can take thousands of points of information over the period of about 30 seconds within the heart and create these electrical maps very rapidly. And this is technology that we didn't have literally 2 months ago. I can tell you we had a patient who was visiting their family from another country, hadn't even been in the United States before, and while they were sitting at the dinner table suffered a cardiac arrest. They were brought to the hospital here and we discovered that this patient had a very weak heart muscle and had a syndrome of heart failure. And we determined that when they had a cardiac arrest, they needed a device to prevent them from having a life-threatening event like this again. And so while they were here, we were able to get them implanted with a device we call a biventricular defibrillator. It's a device that sits up in the chest, and through some blood vessels in the shoulder, we thread wires down into the heart. And this is a series of 3 wires that go in to try and get the heart to pump more effectively, to increase the heart muscle pumping function, so overall the patient can feel better and live longer by having their heart muscle stronger, and also provides backup protection against having a life-threatening heart rhythm. When we deal with a patient, it's not about just speed and doing it as fast as we can. I think it's all about doing it the right way and in the safest way possible. Danbury is a really nice place to take care of patients. The hospital has done a nice job of making sure there's adequate and very skilled and compassionate staff to help patients navigate this. So commonly you'll come across people that you can tell really give their all to their job and they really enjoy what they do. And when people come to work and are really enjoying what they do, it makes it easy to have a good environment. A lot of times it's the attitude that really makes a place special, and the fact that you can tell everyone cares so much about the patient experience that makes it a great place to take care of people.